Good afternoon, everybody. It is October 6th. It's Tuesday. Can't believe it's October already. And we are here for our weekly town hall. This is the day that we dedicate to catching up on what is going on in the world around us and how that is affecting NuPath. Um, we're going to talk a little bit, I think, at the end of this about, or maybe I'm talking about it now. We have we've been doing these town halls and unity forums weekly since March when the pandemic hit. And I'm really kind of proud of us for being able to stick with it as long as we have. It takes some doing to have these consistently, and it takes some doing to attend them consistently. So for those of you out there watching that are still tuning in every week, um, I appreciate it because otherwise I would just be talking into the empty universe. We've talked many times about cutting them back, um, uh, pulling back on the frequency, but at the time it felt like we should continue on with the pace that we had set. But we have made the decision that we will be implementing after this. And going to an every other week schedule for the town hall, and then the opposite week being an every other week schedule for the Unity Forum. So there won't be a Unity Forum this Thursday. It will be the following week, and then the week after that we'll have a town hall. So we'll do them every other week. At the beginning when this all was coming down, we were, I guess you could say we were freaking out, and people really were desperate for information. Um, I guess it's safe to say that we're still freaking out. There's stuff happening every single day, seems like. But I think people have gotten used to the chaos and mayhem. So that's what we're gonna do, just to make it a little bit more tenable. But for this town hall, we're gonna take a look at the data as we often do. I think it's important that we continue to remind ourselves where things stand in Massachusetts when compared to the country, and number of deaths and so forth. So for the current data for Massachusetts is, I saw it flash up there. There it is. We have 9,530 deaths currently, with 135,000 people confirmed with coronavirus. That's an increase of 115 deaths over a week ago at this time. In the United States, we have now topped 210,000 with 7.49 million people infected. The death rate is increased another 5,000 from last week. And I don't know how else to say it, but I think 5,000 is such a huge number, 210,000 is such a huge number. If you're one of those people that has an empty chair at your dining room table or in your home because of COVID, it is so real. It is so real. Even if you haven't been affected by it personally, we know that there's many of our employees and family members that have gotten it, and we've had people pass early on in this pandemic. But globally, we are now at 1.04 million deaths. Staggering. 35.5 million people infected with COVID-19. Number of dead up by 40,000, almost, 40,000 from the previous week. I don't know if there's any good way to help get a sense, and I'm kind of a little bit of a history buff, so I thought we'd take a look at New York City, which we know to be one of the most populous cities, if not the most, in the United States. Of course, it always didn't look like it does now. And I was wondering what the population in New York was over time, and if that could give us any context. Well, looked at the population in 1700, which was about 5,000 people, certainly much more than that now. 1776, when the signing of the Declaration of Independence, there were 25,000 people in New York City. And by 1830, there were 202,589 people in this growing and bustling metropolis. So if you were to wipe out all of the souls living in New York City in 1830, you would still not be at the number of lives lost because of COVID-19. So I don't know if that means anything to anybody, but it's another way of looking at it. As I've said many times, the Massachusetts, well, Department of Public Health, but on the website is this dashboard that we can look at every day. And Middlesex County has had 65 newly confirmed cases reported today, and cumulative confirmed cases to date 28,308. It is has the highest number of COVID cases confirmed over any other county, and Middlesex County has the highest number of deaths related to COVID. So we're sitting in a kind of a hot spot. We've known that for a while. And the department is looking at the new cases that have been confirmed. We talked a little bit about it the last 2 weeks. When we look at regions 3 and 4, we find that we are now in a high transmission region. This is Essex County and Middlesex County. Now, the way they factor this or figure this, it's the number of new cases per 100,000 residents exceeding 40. So region 3, there were 52 new cases per 100,000, and region 4, or I think that's would be Middlesex and Essex, I guess, is region 3, 42 cases. So just tipped into the high transmission region. This sounds all very technical and like I'm getting into the weeds, but it affects us directly and very importantly, because this means that NuPath, along with every other program in these 2 regions, are now having to test all of the staff working in our residential programs every 2 weeks. This is going to be an enormous undertaking for our human resources department and for all of our staff. Anytime we have to do something like this, it's a distraction from so much of the important work that we're trying to do as we continue to monitor the safety and the cleanliness and the protocols in our programs. And so it's unfortunate that this is where we are, but this is where we are. So if you're a staff person out there, please get tested if you need to be tested, because you'll be suspended if you don't. I think if anybody else I'm sure there's other people feeling like I am, that just the constant stress of hearing about this in the news is an enormous thing. Of course, people know by now that as on early Friday morning, President Trump tweeted that he and the First Lady had tested positive for COVID-19. And of course, it was a crazy weekend if you watch CNN like I do constantly. Looking at the super spreader event in the Rose Garden, if that's what it was, and the growing number of people in the president's inner circle that have tested positive, I think we're up to 13 now. This is significant because it is having impacts on so many parts of what's going on right now, including the campaign as we approach the general election. That's just a few days away, less than 30. Of course, if you're a New England Patriots fan, you know the game was postponed due to the fact that there were Cam Newton and the Chiefs had people positive COVID tests, and so this is something that's affecting our enjoyment of some national pastime and in important ways, and will continue to do so. And then this is an article from the Herald I thought just was funny. Massachusetts residents burning up the COVID-19 snitch line. Callers declaring Governor Charlie Baker will spend eternity in hell for his COVID crackdown. To a strip club losing his liquor license after a dancer and patrons were caught without masks. people are crazy, but this shows how important a topic wearing our masks have become. Unfortunately, it is appears to have been politicized, and I know there are people who have a wide variety of opinions about whether or not we're going overboard with the wearing of masks. But here's the thing: um, the CDC and Department of Public Health continue to advise us to wear masks. Most people do. And at NuPath, we will continue to abide by that guidance because I believe it's important. And well, I'm the CEO. So we are going to continue to do that in all our activity and in all our endeavors. I was talking earlier today to a board member and friend, Scott Hagan, who lives in Florida. And Scott was telling me that in Florida, it is every single thing is open. People are wearing masks, he said, but um, much more. I mean, there's nothing restricted there, essentially, and he's nervous. He's got two kids that are in school. So far, he says they continue to have in-person learning, but he's worried that that may change. And there's just so much that we can't predict into how this is going to reshape itself, how it's going to evolve as we go into the cooler months, as we approach winter, and how will this virus continue to torment the citizens of the world until we are able to um, get some defense through a virus. But even that, you know, the more we hear experts talking about it, and the just the enormous undertaking of trying to get this vaccine to over 300 million people in the United States is just presenting some uh, true, truly staggering um, challenges. So we've got to figure this out. We've got to figure out how we're going to continue to safely and effectively provide services to our population, to our stakeholders. We have um, made a promise, a pledge to our families, to our staff, and to the people we serve that we're going to do everything that we possibly can to make sure that we are diminishing, minimizing the possibility of getting COVID-19 while you are on NuPath business or attending NuPath program. And so far, knock wood, we've been successful in that. But at the same time, we have been very thoughtful and cautious, and that has a price too because we are looking at going into the fourth quarter of our financial year. Um, Very concerned about the decrease in the revenues that um, that we can count upon as we go into the new year. So nothing's really ever prepared any of us for this, right? I mean, I know this is a new experience for all of us. I certainly, it hasn't been a lot of fun to be in this position. I will tell you that. And I continue to feel a grave sense of urgency to remind you all, please, please, please wear your masks. Follow the guidance. If we have a spike in the number of cases of COVID, if God forbid, you know, large numbers of people get sick or die, it's going to make everything we're dealing with now seem like nothing. What we're dealing with now is complicated. It's it provokes anxiety in me and our board, I'm sure, and those people that are thinking about things like our ability to manage financially. We'll do it, but it's been a complicated thing, and that none of that's going to be made any easier if people truly are getting sick, because at the end of the day, that's people's health and safety is what really matters. Matters to me, and I know matters to the leadership team and the board and all of us. So for those of you out there that are following the protocols religiously, thank you. And if you're not, um, it's only a matter of time until it catches up with you, because this is a devious little bastard of a virus. All right. I'm going to ask Greg to bring Dan Lannon to join me. Dan is going to talk to us a little bit about where things are with our testing of our broader community, of our congregate care, our residential team. Hi, Dan.
Oh,
How you
hi, Dan.
doing?
Good. And yourself?
Doing all right. So what could you tell us about the being part of this high intensity, or this heightened increased frequency of testing, and how are we doing to your best understanding so far?
Well, first, I think the families and staff have been doing tremendous at the residential programs. And, now with the opening of day programs, that's going very well as well. But I think the visits at the residential programs and the social distancing and wearing proper mask and everything has been great. We've certainly not encountered anyone who has opposed to doing anything we've sort of set up at the residential homes, and they've been respectful of the schedules and the routines that we've put in place there. So I think that's going really good. I think what's concerned a lot of people from our region, DDS in particular, is that this is at a time where we're still outside quite a bit. These numbers are increasing, and we're in that range right now, and we're not even into the colder months where more people are going to be inside. And so I think a lot of providers are having a struggle with on one hand, them telling us to to implement this new testing system, and because we're in a high frequency area, but at the other hand, trying to put forth maybe some different things that contradict that. And so I think we're just balancing those out. And I think as we've done before, and as we'll continue to do, we'll just do, we'll just err on the side of caution and make decisions based on what is the best interest for the health and safety of the individuals we serve, but also being respectful of the families and guardians that want to see their loved ones and not be isolated from them. And so I think, you were on one of the calls this morning. I think people are all over the place as far as their tolerance level with just the way DDS wants to go forward with this testing. I think there's a small group that don't see the value in it, but I think there's a larger group that see the value in it. And so therefore, all the staff did a great job with the first round of surveillance testing, and we were able to meet that. We were able to meet all that, and for those who didn't meet the surveillance testing, they were suspended. Luckily, we only had a very small number of those people, and they will not be able to work a shift again until they meet with HR and go through that process. And so now, as we go forward with the next round of testing, and as you mentioned, the timeline for which they need us to have everyone tested, which is a 2-week timeline. It is a lot of work on the nursing department and on HR department. And so we just want to really make sure that staff understand, what they're supposed to do, where they're supposed to go. And if they have any questions, they're reaching out to their manager or director or to the HR department. So there was a few highlights I wanted to mention about that testing. I don't know, is this a good time?
Yeah, sure. Why don't you go ahead? Yeah.
So just a few highlights, and Karen Franklin is sending this out today as well. And I know staff received an email on Friday, as well as information was communicated to families about what is the next round of testing for our staff, just to make them aware. And so anyone that works in the residential program at all, or has any need to go into the residential program, our facility staff, day staff that work in the residential program, all will undergo testing. And it'll be over the next 2-week period. So from October 1st to the 14th is when we have to complete all the testing and have those results with the HR department to prove to DDS that we completed all this testing. If staff during the baseline testing where we had staff go out to facilities and get tested, this is going to be different. There'll be 2 separate days here at NuPath that our nursing department will be administering the tests. And in the email, it really spells it out how one station will be just helping you get signed up for the app part of it, so you'll be able to manage your results and get your results. And then the next station will be the drive-through testing, for which our nursing department has been trained on and will complete. So I won't go over all the specifics in the email. I do think there's a couple of things that are important. Is make sure you bring your mobile device. Make sure you don't eat, smoke, chew gum, or drink any fluids 30 minutes before the testing. I think those are 2 key things. Make sure you have your mobile device. Make sure you don't eat, drink, smoke 30 minutes before. And the 2 dates, of course, which is probably the most important, is Thursday, October 8th from 3 to 6, and then Tuesday, October 13th from 7 to 10. And there's I started backwards with dates. There's also 3 other dates. Wednesday, October 7th from 10 to 1. Friday, October 9th from 3 to 6. And Wednesday, October 14th from 10 to 1. So there's 5 dates in total, and the times really vary, so that so with everyone doing, with the residential homes being open 24 hours and people doing various shifts and having different responsibilities, it's just really making sure that we gave some options so that people could get in there. So
this is all going to be in the email, or it's
correct.
in the,
yeah.
As you've been talking.
I'm sorry, I just wanted to jump in real quick. So Dan, just for clarification, the 3 dates, the 7th, 9th, and 14th are at New Boston Street. The 8th and 13th are at Liberty Way in Westford.
Correct. Thank you. Thank you for that clarification. Again, I guess I wanted to give a general overview of the dates. I even said to you that I didn't want to get into specifics, and here I am getting into specifics. Just most importantly to know that those 3 key things, and as well as the dates, so that you can get yourself tested and not run the risk of having these opportunities go by and not getting tested, because unlike last time where you could just stop into that facility anytime you wanted to, we're doing the testing ourselves in here. So
when you introduced this, Dan, you said you wanted to thank all the staff who all got tested and all did what they needed to do. And are we still live? My screen just went blank. I don't know why. Am I still there? Oh, it's buffering. Maybe I'm frozen. Weird.
Yeah, no, we're live, but same thing happened to me. So let me just double check that and try to get you back.
I hope I'm not frozen in some.
No, well, Dan, I don't know if you can hear me.
I can hear you.
Yeah, same thing happened to me as well, and so it just went to a white screen. So
yeah.
Well, you can try to re-enable your webcams if it will let you.
Well, if people can hear my voice, maybe it's just as well they don't see my face, because it's not going to be a pretty one. I'll try this again. So, should I keep talking?
Yes.
Yes. So you said that you wanted to thank the staff and all of them for getting tested and so forth. When in reality, we're thanking a group of people who took the charge, who met the responsibility, who did what they needed to do. And then there's a whole nother cluster of people, the stragglers. Maybe there was 100, in the last week or so that still hadn't gotten tested. And then, the last day, I think there were 12 that were still outstanding. These are people that are not relief. These are people that are regular, full-time, part-time employees. And, and now you're talking about some of these details that are going to be in the email, but we know that, and I can't believe I'm saying this, publicly, but because it really looks bad for us as an organization, but less than 1 out of 4 people even bother to open their emails from NuPath. They don't bother to read them. They then bumble into their shifts and act surprised they don't know things. I talked about this new format, well, changing the schedule of our town halls and unity forums, but that's not really even going to meet those people that are kind of on the fringes that aren't, you know, getting tested, or they were in the 100 at the very last minute that weren't getting tested. We are going to this new format that we're calling NuPath Live. Staff will need to go to our YouTube channel in order to see it when it pushes out live. But the whole point of this is that we're going to be able to take it to Instagram, to a number of other digital channels, and hopefully meeting staff where they are, because you can't convince me that our staff are not extremely smart, and most of them are connected through some digital media. It's just what they choose to prioritize as something important. You know, we have got so much going on, and the stakes are so high as an organization that we need people's cooperation. I mean, it is we've always wanted people's cooperation, but as we go into this, to the fall and into the winter, and you know, I have this sort of sense of, like, you know, wanting to just wrap my arms around this organization and just let's just get through this winter, just hoping that medical breakthroughs come, that the vaccine arrives, that people are willing to take it. But we need everybody, you know, paying attention, and we need them taking things seriously. And when we ask them to get something, to do something, we need them to do it and not wait till the last minute, because it's an extraordinary hardship and strain on our human resources if we're chasing around people to the very last minute. We talked to Doreen and Michelle last week. They were, you know, outstanding in their leadership of our residential programs. And I know our managers are working very hard. And as I've said, we've got a core group of staff that are very responsible and abide by the instructions and the guidance that we give. But we need everybody to get on board with this and paying attention. This can't be something that is negotiable. And I mean, I don't know what we can do to ensure that people get the message, but I mean, we're trying to get the message to them, whether or not they follow through with it. But I just wanted to point that out, because this is something that is a mandate. We have no choice. We heard it on the call this morning. You know, when so many of these similar sorts of guidances were put forth for the long-term care facilities, like nursing homes, assisted living. Our own Diane Sespico, who was our board chair, would share with me how they were trying to get everybody tested, all their employees tested, and what a pain it was. But in some ways, in many ways, it's much easier for a long-term residential care facility like a nursing home to get this done, because all the staff come to one place, and we've got our employees scattered to the winds as far as, you know, being in different residential programs. So I don't know what I'm saying exactly. I just want to put it out there that we need all of our employees' help to get this done, because we can't be successful if we don't have people that are cooperating, that are taking it seriously, that are not procrastinating in following through with their responsibility.
Yeah, I guess if I could, you know, just to add to that, you're 100% right, and I think our staff have done a tremendous job. But you know, just the baseline testing being an example. I think the one thing that you're trying to emphasize, and I agree with you as well, is that, you know, not to wait to the last minute. You know, not to think you're going to be able to make this date, or to push it off and not get it done, because it will affect your ability to work in the programs, which, you know, will affect your paycheck, which will ultimately affect us with the hardship of trying to figure out coverage for that shift. And so there is a huge stakes are higher much now than they are normally, with some regular sort of certifications and paperwork that we ask staff to turn in. And so I think that's really what what we want to emphasize is not to wait to the last minute to just, to get this done, to know that it's just a responsibility of the job right now. And as so many things I feel fall into this category, it's just the new norm. It's just the new normal. Like at the beginning we talked about things that people weren't comfortable with, or things that people weren't part of their job descriptions, or specific things that they needed to do. And now it's just the new normal, that this is what we need to do to assure we keep the health and safety of the individuals, your coworkers, and to assure that we are meeting all the guidelines and recommendations that are out there. So I feel good. I feel good that we'll be able to get it done. I do think that the 5 different dates, it was great for HR and nursing to put together. I think they've been very flexible with those dates, and that's a large number. From talking about, well, like Diane shared, to coordinate all that, to make sure you get all the information, to make sure we can keep people working and keep people's shifts as normal, or as routine as they're used to. And so it is a big undertaking, but I'm confident that we can do it.
And not that staff necessarily care to hear these things, but even though things are still so displaced and so unlike the past that we left behind, business is continuing, and we have any number of important, call them distractions, important responsibilities. In fact, I just emailed you, I forwarded you the email from DMA, I guess it is, that wanted to move forward with their the DAHAB audits of Woburn and Westford. I mean, and in any circumstances, this would be a kind of a big deal. I mean, this is a site review, so it's not as we're not have the same consternation maybe as we might if they were looking through the records and everything. But this is this is after everything we've been through for the past 6 months, and these sorts of things are happening. Dealing with the new cost of our health insurance, and dealing with our budget, trying to figure all that out. Things are still happening that require focus and a kind of a fierceness of attention and priority. And if we're distracted by just lack of sort of compliance from our staff, it's going to mean a problem for us in how we are able to cope with and successfully maneuver and navigate through so much of what still is in store for us. I believe, and I worry that we haven't yet seen sort of the worst of it as we move into the fall.
Well, Dean, I'd like to say I look forward to reading that email, but that's an example of the disconnect, I think, that we've experienced all throughout this between Mass Health and DMA and DDS. Those were things that we were told that were going to be put on hold and not prioritized right now, because at the same time they're asking us to dedicate resources to other things which we've never had to do before, or just to maintain, to survive. And so it is disappointing that sort of routine type of process and task that they want to go forward with, they are deciding to do now, with all these other additional responsibilities.
You realize you just said that you look forward to reading that email? You don't look forward to reading that email.
I said I wish I could say. I wish I could say that I look forward to
reading. You said, I'm looking forward to reading that email. No, you're not.
No.
You're most definitely not looking forward to reading that email. Yeah, I think she may have even given like a couple of dates for next week, just as casually as you might say, hey, you want to, get together for coffee or something, so that is going to require a coordinated response, to the departments, Sharon and her nursing team that are really providing, the strong leadership to get these tests in through everybody. In some ways, I kind of feel like it's a sort of a dress rehearsal for when a vaccine becomes available. Now, none of us really know what that sort of reality is going to look like when it comes, because how the doses will be prioritized. It's speculated that the first round will be really focused on, first responders, our medical personnel, our doctors, people working at hospitals, nursing homes, and so that may also, we may be part of an earlier wave of people that are qualified to get the vaccine, because of our working in the field that we do. But that is going to require a mass kind of response. And I'm talking about it now because I want NuPath Nation to hear that we want to be, if given the opportunity when it comes, um, not only willing to take the vaccine, but doing whatever we possibly can to get it, and to avail ourselves of any added protection that can bring us. I don't know if you feel this way or you think about these things, but this experience has been so weird for me, and I find there's been so many things I haven't done for 6 months, that when I suddenly find myself in a situation where I'm doing those things, or my husband John and I, we were this weekend, we did a couple of things that we hadn't done for a while, and on Sunday he did go. He went down to a wake, like a memorial service for a friend that had passed. And I was so uneasy about it. And I was like, so are you really going to be wearing your mask? You promise you're not going to be getting too close to people? These are things that for months, months and months, people weren't even doing that. We went up to when your father had his wake up in Methuen, and Judy had said, oh, well, it's going to be one of these things where people aren't going to then remain. They're going to walk right through and continue on out. But there were some people that were standing around, and I mean, we weren't social distance in the sense that we were far enough away. We had masks on. Everybody had masks on, but we've been successful up until now doing certain things, and I just worry so much that as these little, we lose, our discipline, or the rigor with which we once, I mean, there was a time when I imagined that everything you touched was covered with COVID-19. We know that's probably not the case now, but I just worry that as we begin to relax, that there's going to be this resurgence, and I'm afraid that, what I don't want to have happen is that by the time we realize that we've had, sort of a mass spread of it, that it'll be, all through our programs. And maybe I'm just being a bit of a hypochondriac. I do feel a sense of responsibility to this organization, but I just feel like continuing to hammer into people's heads that we've got to be careful. We've got to be careful and smart.
Yeah, no, I get what you're saying, and I think there's inherent risks to sort of everything we do, and I do think you doing those couple of activities that you haven't done for a while, I think that you try to balance those risks, review sort of what you're going to do, and decide overall if you think you'll be able to keep social distancing and have a mask on the whole time. I think what it doesn't have to be is all or nothing, and that's unfortunately that's what it seems like on social media and all these things. It's either all or nothing. You're either not for a mask, or you want to wear a mask, and so because I do think it's a balancing act. I know you mentioned Scott Hagan, who's on our board. My brother-in-law and sister who live in the Keys, Key West, were here obviously for my father's services and their daughter's wedding, and 77 businesses in Key West have closed their doors. So 77 businesses that people worked, their whole lives to be able to open and do. And so there is the other impact side of what happens if we don't try to, do some form of opening, the economy up or providing services to people. And I do think that, like, for us in the field that we're in, we were open the whole time. Our residential homes were open the whole time. And so I feel more confident that we're able to just continue the same protocols, and yes, we've expanded some things. We've had family visits, to the house. We've had, outings happening, now we have day programs happening. And I think all of those are just steps. And then a certain point's going to come where we're like, all right, well, that's as far as we're going to go. This is what we feel comfortable with. And I think that that's where we're soon, that's what we're soon approaching. You know what I mean? Is like, that's okay. That's our limit. And DDS and DMA haven't done necessarily, haven't outlined that limit specifically. They're trying to, to take a back seat and let providers do that. And so therefore you see different agencies doing different things at different times. And so they sort of tightened up their guidelines a little bit more. But really it's just us coming to an agreement of what we believe is the safest decision, and not too far of a stretch to let people have their mental health.
I think I feel unlike more than ever before that this really is about us working in full unity and collaboration as an entity with our families. I've always depended on the amazing staff that we have working the front lines, that are working directly with people. We know they're the ones that are doing the actual work and fulfilling our mission every day, and I hold such regard and esteem for them. But this is, I guess this is me making just the urgent appeal to our employees to say, look, we need everybody doing what they need to do in order for us to safely get through this thing together. And everybody has got a role in that, however it may be. And you mentioned parents' visitation. We had talked last week, I think, or the week before, maybe it was last week, about whether or not families were going to be granted access to the homes. And I, have a unique, sort of appreciation and understanding for this, given the circumstances of my mother, and, how frustrated it is not to be able to go and directly kind of, look and see what needs to be done within your loved one's space. So hopefully that's something that we're working out, even if we don't, not able to open up. Is that something?
Yeah. So I think that's something that we hopefully, we anticipate having sort of the guidelines, with the new format. Maybe it won't be, we'll highlight it definitely on one of the town hall meetings, but maybe that the first time they hear about it won't be in, this new, in the town hall setting. It might be.
Or we could just send out, and maybe I could just even send a video out, or those out, that it doesn't have to be tied to it, the town hall. But
I think, I think that's, I'll just give a quick example of it. And I think that, we're talking one family at a time. We're talking a schedule. We're talking, once a week. There is discussion around whether dinner should be allowed to be, if people should be able to have dinner in the residential programs with their loved one. And what we're trying to balance out is the idea of then the remaining roommates having to stay into their room so that they social distance, and that's the inherent struggle that we're getting. And so we might, for an example, I think the discussions we've had thus far have been not to allow, like a dining in the house, but we'll still keep that outside while the weather's nice for a little while longer, until we can work through some of these dynamics. Because I am, I am sympathetic to the families that want to get in and spend time and just make sure that their son or daughter has everything they need, and all of that. But I also am sympathetic to those individuals that won't do a great job by being isolated in their room. To, that was the whole reason we opened the COVID center, was we knew that they might, so we're trying to just make sure we're building something that we can sustain.
Right.
So, and we probably it won't be perfect day one. I know it won't be, but we said that about the outdoor visitations, and knock on wood, those have gone very smooth, and families have been great and listening to the guidelines we set up. And so we'll work with the families and try to meet the needs of each family and each group, because each house is different. You know, we have a real medical fragile house. Are we going to have the same guidelines for the real medical fragile house that we're going to have, you know, for the other ones? Those are the things we're gonna
Yeah.
vet out.
You know, and we have some amazing families. I know we do, and just some incredible, you know, sort of affiliates of the organization that have helped us to do with the things that we've needed to do. So I'm highly appreciative of that. We're up against the end of our time here, so I want to just quickly check in with Greg and see if there's any questions that we want to try to address before we sign off.
Yeah, the only question, and you just talked about it, was related to a parent wondering what the time frame is to be able to go into their loved one's room.
Let's try to you know, figure that out. Like,
Well, the
you know,
date that we had kicked around that we wanted to be able to make this happen by was the 16th. We wanted to have them be able to start that, you know, Friday the 16th. 16th is a Friday. Have them start on that Friday and then roll it out then. But that was a sort of soft date that we had, and so definitely we were thinking mid-October we would have this, and so it is something that is prioritized right now.
so we'll maybe it'll happen sooner, but that'll be about the time that you're thinking that it'll happen. There's a bunch of other stuff. I'm not going to get into it really right now. But again, it's another thing that's going to require staff attention and staff compliance and cooperation regarding our cybersecurity, and we'll save this for a later date. But we're going to finally have to start changing our passwords on a regular basis to protect ourselves from any kind of breach in security. That's going to be another thing that's going to demand staff. Well, you know, if there's staff out there that aren't even checking their email, they may not even remember what their password was. But it's something that we're going to need their participation with. And yeah, I mean, this is just the time to really, you know, expand your sense of personal responsibility for what you need to do for this organization. And I don't know how exactly, Dan, but I still plan on doing something to try to honor those employees that have been first to be tested, that have consistently been among the first 100 or so of our employees that have gone and gotten the test and you know done what needed to be done. There's not going to be punitive measures for people that aren't, but I'll tell you, I like to take care of people that are doing the things we want them to be doing, and I'm going to be looking at somehow trying to get a sense of the staff that are making this easy for us and the staff that are making it difficult and are getting suspended as a result. So hopefully we'll see more people in the first column rather than the latter as we go forward. Okay, then let's wrap up. Dan, I just want to say publicly as we conclude this, and next time we get together, we'll be in a different format, but you and your team have just done an incredible job in completely uncharted, you know, territory and waters. I mean, I don't know where we'd be without your leadership and without your just, you know, unflappable, you know, sort of commitment to the people of this great organization. And it's been a terrifying time in some ways for I mean, you've got kids, you know, you're here, and you know, in the early days, not knowing if we were, you know, taking it home to our loved ones, and you've been through your own sort of, you know, life happens, you know, I mean, and things are never easy in that regard, and yet you've been, you know, a real rock. And I just want to, you know, publicly say how much I appreciate you, how much I appreciate the work that you've been doing, and your team of directors. I mean, I may be biased, but I feel like we've got some of the most intelligent and compassionate and driven and dedicated professionals that we could hope to have, like helping to steer this this organization through this time of difficulty, and I'm sure people would agree with me on so many levels that you've been a key and constant part of our response to that. So thank you for all you've done.
Well, thank you for saying that. I will tell you that I appreciate you saying that. I think you mentioned earlier that where you just feel like you're sick of talking about COVID. I think it's one of those things where you feel like you're never doing enough, and that's why I'm just so thankful for Sharon and our nursing team, and Ted and the directors, and everyone who's pitched it. I don't want to start naming names and I'll forget some people, but the billing department, I mean, you had them on here, just everyone has sort of
and the families that are watching, and the families that are still donating money.
Yeah.
Doreen got a $500 donation from the Degadios during the Unity Forum last Thursday.
Yeah, that's awesome. That's awesome.
I just love those guys. I mean, that makes me feel so supported. That makes me feel so like that we're not just, some entity trying to do this, but that we are a family, that we're all together in this, and that strengthens our core response to these challenges.
Yeah, and that's why when we have to highlight maybe those staff that have waited to the end to go get their COVID test, or when we highlight the need for them to read their emails and all that, it is a small majority, and unfortunately it does sometimes end up being where that is what people are hearing. But overall, I will tell you that from every level, the staff have been tremendous, and everyone has just done so much and pitched in, and we had to. And the sad part is, and I said this on a call last week, the sad part is the end of the summer's here. We've been dealing with this for 6 months, and as you mentioned with the DMA thing and now the testing, now it's going to get even busier and hotter. And so we got to make sure that people, everyone has their role, and everyone can do their role, and it's trusting people to do their jobs, and to not try to do too much. And I think that's what I'm so thankful for everyone else, is because sometimes I feel like I'm delaying answers on things, but sometimes I think you just need to step back and remember you're not making these decisions for yourself. You're making them for larger groups, and affects more people. So
Dan, thank you so much. I appreciate your time, and we'll talk again soon, okay?
All right. Thank you very much.
Okay, bye-bye.
Take care.
All right. Well, I feel like this chapter of GoToWebinar is coming to an end here, but what lies in store is going to be far greater and better and more exciting, and give people more of an excuse to tune in. This has been a long one today, and I want to conclude by once again saying, wear your masks, wash your hands, use your hand sanitizers, everything that you've done thus far that's kept you healthy and safe, and kept our programs healthy and safe. We've got this, guys. We can do this. I know we can. We've come so far, and it's just a matter of keeping focused and continuing to do what has gotten us thus far safely, and because of all of your hard work and discipline. So with that, I sign off, and I look forward to seeing you again next week on Thursday for our Unity Forum. All right, guys, take care. Bye-bye.